First of all, I think you have to know we are a pretty young company, and what we have to do is focus, and this is in our genes somehow, focus on the user coming from the technology side. So we always said user first, and you see all our tools are based around the user. Yeah? And if it's good for the user, yeah, it will be a good tool and it will grow. Like we have a lot of tools which have a billion of users, for example. Yeah? And whatever is out there, especially in the healthcare area, yeah, we are interested, obviously, to evaluate it. Yeah? If we can do something. Yeah? And there is so much out we don't know yet. And this is what I meant when I said we are a young company. We know only just a few percent of ideas, what we had so far, what is ahead of us. And our intent is really to help the patient in that sense, by collecting data. I mean, I cannot talk about a specific product, but I can talk about the attitude. Connecting the dots, I think this is the most important thing. And if you look in healthcare, there is so much untapped so far, where we have bits and pieces out there. We have researchers here and there, and they are not connected at this stage. And maybe we will come to a world where we make use of this data, and with the patient's allowance, anonymous data, whatever. I think it's not only within the health sector, it's in general, to make use of the data. Because data on its own, it's worthless. You have to have some intelligence, what you do with it, and what you can learn from it. And this is exactly what we mean. And what I said before, we have to find out what the information is in the data. What can we learn from the data, what we do not know yet, by bringing the data together and bringing the right correlations. I think it's also in our genes that we cooperate. I mean, if you think about Android, if you think at an open source platform, we have the same in the automotive industry, where we have the Automotive Alliance. So obviously this is something we definitely want to do. We are working on, but it takes all the players on the market and the willingness and the readiness to cooperate. And this is what will help us and make progress and drive this innovation. First of all, I mean, data protection is on top of our agenda, and this is something we care about to the deepest and to the fullest, obviously. We also have to make a differentiation between anonymous data and individual personalized data. And with personalized data, you always have to give permission. You have to tick the box, so to say, and say, okay, I'm fine with this. And especially in healthcare, sometimes it's important, and people are willing to do that. We see it on many platforms. People like to share their data for a certain sense. It's not useless, it helps others. And especially, and somehow it's a very sensitive area, but on the other hand, we know it's for the good. I would love to see a bit more of an open mind, and better knowledge of what is out there in this digital world. The more you know, the better it is for us to understand, and make the right use out of it. That goes exactly back to this data. The more I know what is out there, how it helps me, how we can benefit in a complete system here, in a healthcare system. This would be my wish. That we learn what we should do and what we should not do. Much better understanding that we all are at possibly the same level.